The NHS currently has a backlog of cataract patients, some of whom are told that the wait will be 3 years or more. Services such as Spa Medica, who partnered with Optometry today to make this roundtable happen, offer a different solution, performing NHS-funded cataract operations in specialist hospitals. To explore the topic, we gathered 3 optometrists to talk about the current state of operations in their area, improving their referrals, and the changing patient demographics.
I would say I'm actually seeing younger, I'm going to say sort of the 55 plus age group. It's a subtle change they're noticing. They're actually asking for something to be done about it sooner.
They're much more screen-based and they're noticing the glare. They're not as comfortable on the screens as they used to be.
Even the older population are wanting to have something done.
They've had a couple of years where they've been really kind of sheltered away, and now they want to enjoy doing things and having better vision to do it with.
Patients are more educated about what's involved with the cataract. They know what the process is, how quick and easy and pain-free it is. They're not as scared as what they used to be.
Part of that is because we're doing sort of more enhanced examinations now, so we're seeing things much sooner and raising it with them.
They're a lot more reassured by what's involved and the success rate as well, to be fair. They know it's the most commonly performed surgery in the NHS as well. So patients are just generally a lot more informed as to what goes on.
Gurge isn't understating things there. Cataract accounts for around 4% of all NHS operations, which is around 450,000 procedures per year. But now, getting your patient in the door can be hard as cataract requirements have changed, with some CCGs having different requirements to others.
Between CCGs, there is quite a big difference of variety in referral criteria, and it does seem a bit unfair.
We were always restricted with the VAs before, and if you sent anything in, it was sent back with quite a letter back to say you should not refer this person in, which was quite soul destroying sometimes when you could see, how it was affecting the lifestyle. And then the other option was, going private.
I think it's really great that CCGs, from what I can see, seem to really be embracing those lifestyle questions more. I must admit, in Essex, it does seem to be quite regimented with its 612 or worse, and that's it.
Sometimes find that I've sent 1 or 2 in, and actually they've come back a year later not having had the surgery done and having to re-refer them in as well.
And then they get quite annoyed with you as the optom for sending them to the hospital.
Yeah.
And you're thinking, well, I'm only going based on our conversations and the clinical findings. Yeah, I've had that a few times as well, Gurge.
They said, they told me I shouldn't have been referred yet. It's not bad enough.
And you're looking at VAs of like 6-18, 620, and you're thinking, what?
Just determining if a patient can be treated can be a bit tricky sometimes. However, there is a new solution to this problem.
We used to go through a whole list of questions in terms of what medications are you taking? Are there any, reasons for not, any contraindications for surgery, et cetera, et cetera. It's slightly different for us now that we're on the Opera platform. We actually email across the questionnaire to the patient and they fill it in themselves, rather than it just being a question of, right, it's 612. We can discuss it with the patient a bit more in terms of, well, what problems are you having? What aspect of your life are you particularly struggling with? Is it the driving? Is it work?
One of the main questions then that I do ask them, do you want to have something done about it? Because, quite often we go through these processes and saying, yes, you've got cataract, I can get that done, I'll refer you off. But in actual fact, there's some people who actually don't want it done.
This is where specialist hospital providers come in. They can offer an alternate route for your patients. However, sometimes this feels like a novel concept to them, leading to some misconceptions.
The most common myth, I would say, is even when I've done my spiel, I've explained about the options that are available to them, and I say, you've got actually options outside of an NHS hospital, and their response a lot of the time is, how much do I have to pay for that? Even though you've initially said this is your NHS options, there's that big myth there from patients that they feel they're going to have to pay.
When we initially kind of started referring our patients to Spa Medica, and the closest one from us was Bolton, which is quite a distance away, people used to be quite put off. The moment you tell them that actually Spa Medica will actually pick you up and drop you off as well, that kind of really quite quickly persuade them to actually, let's go for Spa Medica because the waiting time is shorter.
In our area, it can be sort of 4 to 8 weeks before you're contacted.
The fact that there'll be less volume, less patients there on a hygiene and a COVID perspective is reassuring to the patient as well.
The biggest thing for me has been visiting the clinic, understanding the patient journey, both pre-assessment and post-operatively as well, how the patient journey generally runs in that setting. Things like parking, accessibility. I think if you're going to refer a patient to a non-NHS setting, for me, I've needed the reassurance that they can, what they would do if the patient had a post-operative complication. So that's been really good to actually speak to the surgeons and, understand that better. In terms of referrals that are actually sent in terms of clinical information, things I have learned along the way is certain types of cataract are more difficult for them to treat than others. So for example, if it's a posterior subcapsular cataract, that's more difficult for them to treat. So make sure you clearly state that in your referral letter. Another thing that I picked up from the hospital optometrist at Spa Medica was to say, if you can't view the posterior pole, if you don't get a good view, even on dilation, make sure you put that in your referral letter, because they have the facilities to have an OCT pre-operatively. And also on the flip side of that, if I have done OCT, then I will make sure I've documented that the macula was clear, there was no sign of macular degeneration. From going to sort of CPD evenings at Spa Medica and actually seeing the facilities and talking to the surgeon and the hospital optometrists, I've struck up a relationship with the staff at the local hospital to me.
It's very useful to just be able to, drop them a text or give them a call, say, well, this is what we've got. How can you help?
Any queries, we just speak to the business support lady and, I text her and she will answer back usually within half an hour or so.
This isn't the only place where Spa Medica pride themselves on their communication. They also routinely communicate with the referring optometrist after they have done the surgery.
I find it very useful to get the feedback, and actually patients expect us to have feedback. Whereas before, just from, say, the local NHS hospital, we had nothing for them to say what had been done, etc.
It's not just after they've done the surgery that we receive the letters, it's pre as well, to let us know what's going on, when.
I think as a clinician, having feedback on any referral or treatment that's been done is really good for your own self-reflection, your own further learning, so that you can refine your future referrals. Having that joined up approach between primary and secondary care is just vital. It just improves everything, doesn't it? The patient journey, referral, management, follow-up, everything is better when you've got a more joined up approach.
Absolutely vital. There remains a chain of communication between both us and the hospital provider, and inevitably NHS hospitals don't provide the level of communication that Spa Medica does, to be fair. We do sometimes now get feedback from the online platform via Opera as well.
Literally at our last local optical committee meeting, we were talking about feedback from NHS versus private. And actually, I think a lot of the doctors, it transpires, who work in the NHS, they do ask for that feedback, but sometimes it's just so busy, there's so many patients that it can just get a bit lost in the admin process, that actually a copy letter comes out to the optometrist as well. Spa Medica do that communication really well, but it is a smaller setting. It is something that's more niche and specialist, to what they're providing. So just in a bit of defense to the hospitals, I think the intention is there to send the communication out. It's just you're dealing with such a big beast that sometimes that just doesn't happen. From the doctors we speak to, they are trying and they are aware, and that they know that feedback is really important to get back to optometrists. But sometimes it is a more difficult mountain to climb for them, I think.